Today, we are closing this work period the way we started our work this Congress, with a hearing on prescription drug prices. This is a bipartisan issue, and I've focused on for many years. The first witness at our hearing this Congress was a woman named Antoinette Worsham, a mother whose daughter died at 22 years of age after rationing insulin because she could not afford it. And it was the subject of our hearing on the HIV prevention drug in May. Today, 5 patients and a family member are here to share their stories. I urge all members to go back to your districts and to talk to your constituents about their experiences struggling to pay for life-saving drugs. I fear you will discover that we are facing a drug pricing crisis in America. We've seen time and time again drug companies skyrocketing prices are forcing families to make gut-wrenching choices every day. Many families have to choose between caring for themselves and their loved ones or paying for basic necessities. These skyrocketing prices are forcing families to take on debt, sacrifice their homes, or sacrifice their health care altogether. Imagine having to pick between having a roof over your head or protecting your child's life, between eating that day or taking a pill that you need to simply stay alive. For Americans around the country, these situations are an everyday reality. Think about it. Americans are dying every year while pharmaceutical companies enjoy more and more profits. Our witnesses today represent the 1 in 4 Americans who struggle to afford the drugs that keep them healthy and, in many cases, keep them alive. Unfortunately, drug companies continue to raise prices, rake in record profits, and lavishly reward their executives and shareholders, all while stifling competition and preventing access to life-saving drugs. Drug companies make up only a quarter of the healthcare industry, but they collect more than half of its profits. Some drugs are developed with federal funding, yet the industry ignores its responsibility to the American taxpayer and reaps massive profits from our investments. Drug companies use a variety of tactics to increase their profitability. They use loopholes in the patent system and to pay for delay agreements with competitors to extend monopolies so they can keep increasing their prices. And even when there's supposed to be competition, so-called competitors increase their prices in lockstep, stuffing their pockets while the American families are left paying the bill. To be sure, we all want drug companies to be successful. We want them to innovate. All of us depend on the pharmaceutical industry to develop cutting-edge therapies and breakthrough drugs. But what we cannot abide is profiteering at the expense of patients and the American taxpayers. That is why the committee has been investigating the pharmaceutical industry's price increases. This investigation, which began in January, focused on the 17 highest costing drugs for the Medicare Part D program. Our investigation has made significant progress, but we plan to do more. Let me be very clear. The committee will take all the steps necessary to ensure full compliance with our investigation, including with our requests to drug companies for documents showing why they're increasing their prices dramatically and how they're using the proceeds and what steps can be taken to reduce the prices. Our investigation will allow the American public to lift the veil on the industry's pricing practices, and we will help inform the policy solutions to bring drug prices down. This is a problem that everyone, even in this polarized time, can come together to address, and I am hopeful this hearing will be another step in that direction. Now I yield to the distinguished ranking member of our committee, Mr. Jordan.